Welcome back to Morning Mix, our Wellness Wednesday now. October is Health Literacy Month, and with open enrollment right around the corner for many, it's a perfect time to make sure you understand what your insurance is and what it can do.
That's right. Dr. Janice Coffin and student Dr. Jaron Longo from AU Health are joining us this morning to discuss this information. All right, thank you both for coming on the show.
Good morning. Thank you for having us.
Nice to have you back. Dr. Longo, let's start. What is health literacy and why is this so important to us?
So thank you for having me on today. So health literacy is essentially a patient's ability to both understand and to act on their health information. And so why is this important? It is because your health literacy can affect your annual health care cost. And so we found that patients that have a lower health literacy will have an annual healthcare cost of $13,000 compared to patients with a higher health literacy that can be around $3,000. So there can be a big discrepancy in your healthcare costs. Some patients that might be vulnerable to having low healthcare or health literacy might be patients that are elderly, chronic disease, or patients who are immigrants.
Those are pretty good reasons why. Why else should health literacy, why do you need those good skills?
So some things that you might need to do with having good health literacy are taking care of diseases such as diabetes, being able to control your diet, be able to follow medication instructions, what time of day, when to take your medications, understanding your test results, be able to communicate your health symptoms to your health professionals, understand when your appointments are, as well as participate in health discussions and the decision-making of your health.
So let's talk about, for people that have low health literacy, what are they at risk for, Dr. Coffin?
Yeah, so that's a great question. So for patients, if they don't understand their health conditions very well, this can lead to, uncontrolled diabetes or their blood pressure being out of control. That then can lead to patients going to the emergency room more often, which is very expensive. It can lead to increased hospitalization and hospital stays. It also increases mortality rates. So death rate is higher for those that have lower health literacy rates. And actually, we want a good quality of life. So if your health conditions are not managed and they're not under good control, quality of life is not very good for those patients.
And now what can people do to increase their health literacy?
Yeah, so that's a great question. So first thing, and I encourage patients to do, is you want to keep a list of all of your medications. Have a list of your medications and what those medications are used for. So if it's metformin, it's because you have diabetes mellitus. If you're on losartan, it's because you have hypertension. So it lists not only your medications, but what are your health problems. Second thing is, sometimes, when you go into the doctor's office, it can be very busy and sometimes things seem to be rushed. And sometimes we can use medical jargon, which the patient may not understand. So if you don't understand what your provider is telling you, either have them write it down, reword it in an understanding that you understand, or go to some of those health websites like the American Diabetic Association, the American Heart Association. There's a lot of information out there if you know where to find it. But most chronic conditions, again, like diabetes, hypertension, there are specific websites that you can go to find more information. And as Will Rogers mentioned earlier, this is the time for open enrollment. So understanding what is your health insurance, what does your health insurance cover, what medications does it cover, and then being able to have that conversation with your health provider about, okay, what lab tests do I need, what medications can I afford, what will my insurance pay for. So it's knowing what insurance you have and what it pays for, and talking to your provider about coming up with the best decisions for your health care. So please don't be afraid to ask those questions, or write your questions down before you go in to talk to your provider, because sometimes we get nervous and we forget. But if you have a list of those things, you're prepared and you're ready to ask those questions.
We should do a combined segment with Will and Dr. Coffin.
I think so. I like it. They're always in tune, right? And this is an important topic. Dr. Coffin, I know you mentioned a couple websites earlier where people can go for more information. Are there other ones?
Yeah, so my always go-to is the Center for Disease Control, so the cdc.gov. If you just type in diabetes or hypertension, lots of information. But the American Diabetic Association, the American Heart Association, the American Cancer Society, if you have any type of cancers, lots of information out there. Knowledge is power, right? So we need to educate ourselves about our chronic conditions, or if we have questions, go to those sites that have good health information and that have been trusted and that have been around for many years. Sometimes we go to sites like TikTok. I don't know if that's the best information, right? Or so American Diabetic Association, American Heart Association, the Centers for Disease Control, all great information. Again, talk to your healthcare provider as well just to see what they recommend.
I don't think TikTok has been endorsed by the AMA, so maybe you shouldn't go there on that. All right. There are no dumb questions, especially when it comes to your health. So,
That's
yeah, very
absolutely
much so.
right. That's absolutely right.
All right, Dr. Coffin, Dr. Longo, thanks so much for joining us here
Thank
today.
you.
Appreciate
Thank
it.
you.